Welcome to the Massage Tools Podcast, your home for cool interviews and reviews. To kind of shift gears a little bit, because I like talking the business side of it, but I am curious too about your Diamond method. And can you explained a little bit earlier with it sounding a little bit like some pin and stretch with active client movement, but will you talk a little bit more about your method?
Yeah. It's based on, I call it there's 7-step success framework. And if you hang in my campus a while, you'll know that I'm all about marketing. And so part of what I came up with years ago with the Diamond method is that there are 7 letters in Diamond, D-I-A-M-O-N-D, which correlates to exactly what we do in clinical practice with active myofascial therapy clients. When we do that, and you can apply this pretty much in any technique, but what it does is it creates a framework for the session as well as a framework for the therapy plan. So, again, I always kind of tie in business and clinical. You asked me, Kelly, what one of the things that therapists should be focused on. They should be focused also on not thinking only about single sessions. Single session is great. You wake up, your neck is kinked, come in for a session, boom, you're done. Good, that's fine. But sometimes the problem is bigger or the goal is bigger. So they need a program or a therapy plan. So we take them through these 7 steps that help identify what the goals are, how to create the therapy plan, how to know what should go into that plan, how long it should be, what else is in there. And then based on that therapy plan, the client ends up with a quantitative result. So with the Diamond method, yes, the client is actively participating. Yes, there's some pin and stretch pieces to it where you're pinning and stretching, but then they're moving.
Okay.
There's the biopsychosocial. I don't know if people are familiar with that term, but we also use a lot of dialogue and conversation. So we're involving the client as, they're not a recipient of the session. All too often in basic massage, the client lays on the table and we push on them, and then they get up and they say, oh, I feel better. Okay, that's great. They feel better. But what does that really mean? And how do we help them notice the changes? How do we help them articulate the changes? How do we help them facilitate the changes and therefore maintain those changes once they've left our treatment room? So we work on all those pieces. So it's definitely a comprehensive system. It's not a tool. It's not like, oh, you do this with your hands for 3 seconds and then, follow the sequence. It's individualized. There's a structure to it. But within the structure, the therapist obviously has the freedom to be able to work specifically with that client and what their goals and needs are.
That's an excellent element. I feel a large number of the continuing ed out there is kind of like you were just saying, where it's just they show you a technique, but they don't talk about maybe integration into your practice or how to frame it overall. It's here's a new screwdriver to put in your toolbox and then go about how you've been doing it. So
have fun.
Yeah.
That's really, I'm glad you recognize that because, and again, when we're starting, I think it makes sense. Give me the screwdriver. Give me the hammer. Oh, somebody has a nail that needs to be pushed in. Let me use the hammer, not the screwdriver. So I think from the very beginning, when we're starting, that makes sense. But as providers progress, we recognize there's way more to it. It's not just the tools. It's how do you integrate it? How do you think about it? What are the other components? So bio is the biological. That's where, okay, yes, this tissue is tight. Biologically, we know we want to relieve it, but we now know the psycho and the social components are more impactful in relieving the tight upper trap than us going in there and squeezing on it. And that's the piece that I think a lot of therapists miss and that they have to start understanding is really an integral component of their, it should be an integral component of their success.
Now the biopsychosocial model, I know it's a little more recent as far as its term. Conceptually, it's been around, at least since the 70s, if not longer than that. But
Kelly, I went to college in Springfield, Massachusetts. Mm-hmm. Spirit, Mind, and Body, the YMCA, Spirit, Mind, and Body. It's been around for hundreds and hundreds of years.
Absolutely. And was just kind of going off of the like I said, the term we're biopsychosocial. It's a much more recent packaging of a concept.
Yes.
But with with those elements, I mean, are those things that you learned outside of the massage industry, or was it through guidance of other massage therapists you interacted with or other professionals?
I think originally it just came naturally to me. People would get results, and the reason was because I actually listened. I asked questions. I talked with them. I thought about what other components were impacting them. I may not have consciously been aware of it, but we now know, of course, just the dialogue, just how you spend time and you make eye contact with people. It helps them clinically. And too often they don't get that. And too often in certain therapy environments, the therapist will say to the client, oh, good to see you again. So go ahead and lay on the table face down. I'll be back in a minute. And there's no interaction. There's no dialogue. There's no connecting. And those clients aren't getting the full complement of what they could be getting if they had a therapist who was paying attention to them, more comprehensively, not just biologically.
Yeah, that's definitely an advantage to our profession, I'd say, because I know even when I work with sports teams, I'll go in and sometimes I just have a 20-minute session with an athlete, but I often get more FaceTime with them in those 20-minute sessions once a week, every other week, than sometimes they do with their coaches, the sports medicine individuals they're interacting with, strength coaches and whatnot. They're like, yeah, this has sort of been bothering me for 3 months. And I'm like, why haven't you told anybody? They're like, I didn't want to get in line in the athletic training room, or I didn't want to, talk to coach about it. Because with athletes, there's definitely an apprehension with aches, pains, injuries, because they're worried they could get pulled from, the starting lineup or the conference team or things like that. But there have definitely been some opportunities as a massage therapist that no other professional in the small little network had the opportunity, just because of time, because of that direct interaction. So it's at that point you made resonates with me very deeply. So.
Yeah, when I first started, I thought professional athletes was going to be my niche, and it was. And I worked with basketball and football players, and there's such conflict too, because you can tell them to do one thing, and their athletic trainers tell them to do another thing, and you're right, they don't want to admit injury or pain because that could affect whether or not they play. Yeah.
Yeah, it's a little bit of coaching of the athlete and how to maybe approach the athletic training staff with it. And the other part of it is communication. And Tom and I talked about this a little bit, but going over and interacting with the athletic trainer or anyone else in sports med and saying, hey, they're dealing with this. Like, obviously their performance is still high enough, but let's see what ground we can make to alleviate this and not change, the current action or their current playability or whatnot. But just talk, I guess. Talk to people, something like that. I don't know. So you have so many fun directions to go, but one thing we've talked a little business, a little bit clinical, but when it comes to new students, what's a piece of advice you like to give to someone maybe just getting in the field?
Get your hands on as many people as you can. Figure out who you want to work with, who you like to work with, who you get good results with. So different populations, right? Different environments. So whether you're going out and doing, post-event sports massage, or you're in a pediatric clinic, whatever, try to be familiar with as many different populations, conditions, situations as you can. That way you can start to find out who your dream clients are. Second thing, And this, again, I just fell into this by accident, but it was brilliant. And if you can find, and this goes to not only beginning therapists, but people who've been in the trenches for a while, other people have the clientele that you want to work with. They already have those people. So it's not like you're just trying to find them out of the blue. So go where those people are. So when I started my practice, I was a personal fitness trainer, and one of the trainers was opening up a gym. So I started seeing clients in his gym. Well, he had the members. I didn't need to go find the members. So I worked out an arrangement where I was able to offer his members a session, which then gave them the introduction to me. So my marketing pretty much was done. I needed to be good, and I needed to continue and retain these clients. They didn't need to go find them. So the advice I would give is identify who already has your dream client and go and create relationships with them so they can then refer people to you. Word of mouth referral is fine, but it's not predictable. So you need to create reproducible referral systems. If I asked you, here I go coaching and teaching, but if I asked all of you listening, raise your hand if you have at least one system to get referrals consistently. Most people would not be able to raise their hand. So those of you, raise your hand if you have at least one system. Now, keep your hand up if you have two systems. Most people, they don't. So again, you can pay for advertising. Yeah, I guess you could. But you can also do it organically, but you need to know how to do it and you need to set it up. But if you can get 3 or 4, imagine 3 or 4, it's like fishing poles in the water, right? If you can catch a fish with one pole, imagine if you had 3 or 4 out there. Well, chances are you're going to catch more fish. So if you get 2 or 3 or 4 or 5 people or organizations or companies referring clients to you on a consistent basis, you don't need to do that piece anymore.
Okay.
That's the advice I would give.
Yeah, that's wonderful. That's wonderful advice. So that gives us some things to focus on coming out of school. There's obviously learning the Diamond method, but were there continuing ed courses that were really valuable to you either early on or that you know that are still in the mix nowadays that you can recommend?
Well, a lot of the educators are my colleagues and friends, personal friends now over the years. There are some people who are really good educators. There are people who are still teaching things that are obsolete and outdated and have not revamped their curriculum nor kept up with science because things change.
Sure.
So there's still lots and lots of schools and lots of educators that I think should not be teaching. So I'm going to say, instead of who I would recommend, I'm going to say do your due diligence and make sure before you sign up for a class or a training that the provider is current, that they're teaching current information, especially when it comes to, again, the biopsychosocial or, we used to think, people used to call me the posture girl. Well, I broke my neck, so I stand straight. I tend to stand straight. I used to teach posture all the time. Well, now we know posture's, it's hunched over a phone is not what's causing our neck and back pain. Being in that position for extended periods is, so let's get up and move, but it's not the posture per se. So we need to have people who are staying current. Assessing skills, evaluation skills, those are invaluable. If you get a client on your table and you have not assessed them, assessed for range of motion, assessed for tissue texture, assessed for muscle strength or weakness, done the evaluation as far as asking them what their clinical goals are, what they've tried, what they haven't tried, all that stuff. If you haven't done that, then I think you're doing them a disservice. Then you're really just sort of winging it. You're winging it and wishing, as I say. You need to assess. So if you can take a class on assessing or even get books, there's so much research you can do on your own. You need to be able to know what's going on clinically with these people before you start touching them.
Okay. Yeah, that's wonderful advice. That's those are the courses that I tend to seek out most, or at least methodologies that I like to follow. Because I tend to have a fairly thorough exam with my clients when they come in, new clients in particular, or new issues, and they're like, this is different. And I'm like, yes, hopefully the result's different for you as well. But, I want to be able to test this. And I kind of joke around with my clients, any of them that have had any clinical experience. And I'm like, if they know, it's like, oh, this is the Thomas test or the Thompson test or so-and-so's and whatnot. And I'm like, what movement bugs you right now? And they'll be like, it's kind of only when I get my arm in this weird, odd position. I'm like, all right, it's the client name test. So it's the Irene test today. And that's we're going to test that. We do some work, come back to it, test it again, do some work, come back. And they're like, it doesn't hurt anymore, or it hurts way less, or things like that. So I'm like, yeah, well, I love the standard orthopedic test, but I like the client's version of a special test too, because that's their meaningful movement. That's what's bugging them the most. So let's address it. And it's a real clear, almost binary in the sense of what we're doing is working or it's not working, and then continue from there. So. Right.
Well, it's a before and after that they can experience. But here's the thing, again, Kelly, I'll just caution you. Mm-hmm. Correlation does not indicate causation.
True.
So we have to keep that in mind. Again, we used to think they're better because of what we teach them. Well, they may be better just because you have a friendly face and a nice smile and you're paying attention to them for an hour. So that's, again, the current understanding.
True. Yeah, that those components are absolutely part of it. They're a trickier one to
quantify.
Yeah, exactly. The trickier one to quantify. It's a great way to phrase it. So there's business stuff. There's the biopsychosocial model, which you could really put in the massage box or not put it in the massage box as far as education. But is there anything else that's not directly massage that's been beneficial to you, or that you would recommend to somebody either new or not new into the field? So,
in addition to the business and to the biopsychosocial?
Sure. Yeah.
Any interpersonal skills.
Okay.
Communication, confidence. I do a training called started with the 3 C's, then I went to the 4 C's, then the 5 C's, and there's like 7 C's, but confidence. Somebody goes and gets their knee gonna have surgery. You want a doctor who's confident, who can get you, who you can instill confidence in you that you're in good hands. Well, if you come in as a therapist and you're feeling kind of hesitant and shy and timid, doesn't instill a whole lot of confidence. So even these, they call them soft skills, these interpersonal skills where you're dialoguing and you're communicating and you're, what are you wearing, your appearance, all of that may seem superficial, but it can make or break a practitioner's business. Where your office is located. I didn't know, but that gym I referred to, it was in the heart of the worst area of San Francisco. I didn't know that at the time because I was new to the city. It was a horrible area. Like literally, I would walk out to my car and wonder, are my windows going to be intact on my car? And I didn't know until I moved to a better area that many clients wanted to refer their friends to me, but they didn't because they didn't feel that their friend would be safe in that area. But I didn't know that. I didn't know that was an obstacle that I had against me. I wasn't even aware of it. So we need to look at all these pieces of our business to see what's helping us, what's hindering us.
Yeah, that's a great sentiment. I ran into a similar problem where I had an office in one part of town, moved to another part of town, and I lost probably half of my regulars simply because they didn't want to drive to that part of town. And it wasn't the drive itself, it was the location. And then I ended up building up clientele that lived in that area, so it all worked out in the end. But for a moment, it's like, whoa, why is half of my book empty compared to what it was? And then I just had to rebuild.
Habit. So even if it's 4 blocks, it's a different area.
Thank you for joining us, folks. The mission of Massage Tools Podcast is to inspire. So help us inspire you. Ask questions, leave suggestions in the comments section. Give us a like if you enjoyed the video. And if you want to see more content, please click that subscribe button, turn on your notifications, and hey, check out these links for other videos here.